From those first COVID-19 vaccinations to booster shots, there are growing options for people, young and old, to protect themselves from coronavirus.
It's leading to questions about the future. Will we need annual booster shots? Will these vaccines combat new variants? And will we ever reach herd immunity? Dr. Max Gomez sorts through the confusion.
In order to get a handle on this pandemic, experts say we need to reach something called herd immunity.
I think we need to at least have 90% of the population that is protected by either vaccination or natural infection or the combination of both.
But the U.S. is not even at 60% vaccinated at this point. Dr. Paul Offit, a professor of pediatrics at the Perelman School of Medicine at the University of Pennsylvania and a member of the FDA vaccine recommendation panel, says we may be able to reach some form of herd immunity.
If you define herd immunity as a critical decrease in this virus's ability to spread from one person to another, so much so that you have a dramatic decrease in hospitalizations and deaths, I think the answer is yes. But in order to do that, we're going to have to figure out a way to vaccinate the unvaccinated.
The question is, why have so many people refused the COVID vaccines? One argument is that we accept the flu, which causes 400 to 700,000 hospitalizations and 20 to 60,000 deaths a year. But
in many ways, this virus is worse than flu. What this virus does that frankly no respiratory virus does is it causes you to make an immune response to the lining of your own blood vessels, causing inflammation or vasculitis. And therefore, all organ systems can be affected. I mean, for children, that disease is called MIS-C, multi-system inflammatory disease, where kids come into our hospital with not only lung disease, but heart, liver, kidney disease. It's hard to watch.
The good news is that new vaccine technology will allow us to develop vaccines effective against new variants. But the challenge remains how to reach herd immunity.
If we start to see variants that are produced that are more and more resistant to vaccine-induced immunity, that's going to be a problem. I think, too, and this is one of the biggest ones, is misinformation. There's just a lot of bad information out there that's readily available that's causing people to make bad decisions for themselves and for their children. The third is nobody should tell me what to do with my body, which is fine if you're talking about not getting a tetanus vaccine. I mean, if you step on a rusty nail, choose not to get a tetanus vaccine, get tetanus, no one's going to catch tetanus from you. It's not a contagious disease. That's a personal choice. This is a contagious virus. This is a virus that you can transmit to other people. So you're not just making a personal choice. And I think that's probably the most upsetting part in all this, which is we just don't seem to care about our neighbor.